Hey guys, Sally Kruger here with FBN. We've just finished our Rural Healthcare on the Farm panel here at Farmer to Farmer 4. I'm really excited to introduce you to Rachel Hartford. She's an administrator at Heartland Community Health Center in Lawrence, Kansas. Rachel, I just wanted to ask you if you would tell us, how was the panel today and what were some of the things that farmers wanted to know about health?
Yeah, I think healthcare on the farm is an important topic, and we heard a lot today about the complexity of the healthcare system, the cost of the healthcare system, and access to the system. And at the end of the day, we had some discussion about, is healthcare a right? Is it a privilege? How do you navigate? Is there any wrong door into the system? And so today, I think, hopefully our farmers walked away feeling supported and excited about the innovation and the support that's on the horizon for their business and their enterprise.
We heard a little bit about telemedicine and how technology can play a role in making sure that farmers have access to the kind of care that they need. Can you talk about that a little bit?
Sure. Telemedicine is a pretty innovative touch. When you think about trying to recruit and retain providers out in rural communities, or when you're trying to increase access, telemedicine is going to hopefully be a great tool that meets people right where they're at. I was talking after the session with a farmer. What does it look like instead of having to have farmers drive 200 miles in to see a doctor? Let's take that care team to them. And in a way, that's what telemedicine it does. It accomplishes not having farmers to take off a lot of time from work, not having to take the risk and leave their property, leave their farm. We're going to come to you, and I think that makes a difference when you talk about being patient-centered and increasing access.
Yeah, that's awesome. We heard a little bit too about how the system that exists today primarily exists around employer-based care, healthcare, insurance, and coverage. So, can you talk about the perspective of a community health center and what kind of services you provide and what that might mean for farmers when they need to get access to those things?
Yeah, community health centers actually more than half. We exist all across the country, but 49% of community health centers actually live in rural areas. That's awesome. And so like one of seven of a rural health or rural resident will receive help from a community health center. And at the end of the day, community health centers, we exist to close the gap that exists for so many people. Oftentimes we have a lot of folks that can't afford enough money to buy private insurance, they don't meet the mark for the marketplace, and they don't qualify for state support. And so they're in this gap. What do you do? And at a community health center, whether you're insured, uninsured, underserved, that can be your health home for your entire family. And so in a way, you want to think, where can I go to get all my needs met? Theoretically, community health centers should do that for you, regardless of your insurance status, regardless of ability to pay. And really, that's what we're talking about when you talk about costs and trying to navigate the system. At the end of the day, we need to see a doctor. And so community health centers, they exist. They're all around. You can look them up, but it's a really great first stop.
Cool. We talked about a little bit on the panel from a few folks, mental health in rural communities, which is obviously a really important issue. I know that you mentioned specifically social determinants of that. Can you explain what that means?
Sure.
I'm sure farmers are wondering what that actually means and what it means for them.
So in essence, social determinants of health, think about the social factors in your life. Where you eat, how you eat, what you eat, who you hang out with. Do you exercise? Where do you worship? Do you worship? Are you a part of a social group? Are you part of a Rotary? What's your social support look like? Where do you live? I mean, that's a big part. If you live in rural America, that's part of your social determinants of health versus if you live in a city. All the things that surround us each and every day. People think that all of your health care is based upon biology. Well, actually, that's like the lowest percentage. Your health care is made up of where do you sleep at night? Where do you live? Who do you hang with? And so
the idea is that those things impact your
100%,
personal wellness.
very much so. And then you can talk about behavior change too. So you can have all the resources, you can have affordable health care, but if we're not willing to make behavior changes, then we're probably not going to be successful in having improved health outcomes. And so when you think about behavior change, or when you think about addressing social determinants of health, which, fun fact, we just learned earlier this week that one of the most recent social determinants of health is loneliness.
Oh, wow.
But that is part of your social health. Like, who do you hang with? Do you have a support group? Who do you call at night when a piece of equipment breaks down? Those things matter.
Cool. That's awesome. Well, thanks so much for being here. Thanks for being on the panel and
it was
participating.
great.
It was good to have you.
Yeah.
Fellow Kansan for me, which is great.
Yeah.
Remember, guys, that there's so much more good stuff coming out of Farmer to Farmer 4 here in Omaha. Stay tuned. You can follow us live, follow along with the event on Twitter.